Alright, today I'm going to be administrating my IV, one piggyback med, and then one spiking both of these, the piggyback medication, and then also my sodium chloride injection that is off. The top part is off, so it's kind of leaking. First thing I want to do is wash my hands, identify, normally I'd have a patient here, identify myself to the patient. So my name is Ian. I'm going to be a student nurse. I'm going to be giving you some sodium chloride and a piggyback medication. Can you go verify your full name and your date of birth for me, please? And I'm going to be verifying that with the patient on their wristband as well. I'm going to go through, before I even got to this point, I'd be going through the 5 rights. I'll be on my second, or going on to my third check right here. So I want to make sure that and do all that before I even get to this spot. Make sure that there's orders from the physician to give this the saline and this piggyback medication before I'm here as well. All right, and then after that, I'm going to get my. So this is my sodium chloride, 500 milliliters. And normally this would be capped, but we have to keep using this over again. So this would be sterile in real life. I've already gotten my line out here. And this would also be sterile as well. There'd be a cover on this. I'll be taking that cover off. I'll be spiking my bag. Getting it all the way down to that little divot. And then I'm going to squeeze some out. Hang it. And then I'm going to prime the line. Slowly let it out. Over the garbage can. That's really good. Get all these air bubbles out that are in here. Alright, looks like everything looks good. The line is running well, normal. Made a little bit of a mess, so you'd be doing this over a sink normally. Alright, so and this would be normally, I would be able to normally hook this up to my patient here. We would have an IV in. I want to make sure that this is kept sterile at all times because it's going to be going into the patient. Then to run my piggyback. So let's pretend this is in the patient. Run my piggyback. I'm going to have to lower my primary medication and then put the piggyback into the higher height. Alright, so here's my other medication, my piggyback medication. Also I can also identify the time and date that I administered this medication, and then also I can do the same thing on the primary line as well. I'm going to do that same thing with this for my piggyback medication as well. I'm going to wash my hands again. Make sure to go through my 5 rights and my third check right here. This would have a cap on it. Normally I take the cap off. This would be covered as well, be sterile. I'm going to spike the bag until it goes all the way up to the divot. Attach this. Actually, before that I want to prime it. higher position. Going well. Okay. Make sure that I clean this up. If as they get contaminated, I'll use a little alcohol wipe before attaching. Push it in, twist, and then we can start to give this medication by opening up the line. And primary line. Like normally this would be going into the patient, so you wouldn't be making a mess at this time. But as you can hear, everything is flowing well right now. Alright, so after you give the medication, or once you start the medication, I want to make sure that there's no infiltration going on with the patient, no edema, no allergic reaction. Document everything that you just did, including the medication bags and the tubing. And make sure the patient is comfortable and then in a safe position. Wash your hands and document, and that's it.